ending up in the hospital and then ending up in debt.
A new report today says many of the state's hospitals are billing some of their poorest patients when they shouldn't have been. Our Capitol reporter Michael Hyland is live in Raleigh. Michael, some state lawmakers are calling for change.
Right, this report highlights the tax breaks that many nonprofit hospitals get, but then says that many of them are not providing enough in charity care. Hospital leaders blasted this report that the Treasurer's office put out, calling it potentially dangerous.
An unexpected stay at the hospital could lead to unexpected hardship for those who can ill afford it.
Medical debt is the most likely kind of debt to lead North Carolinians to bankruptcy.
That happened to Bev Veals, a cancer survivor, who recently told us about racking up nearly $200,000 in medical debt.
That's when everything kind of started really spiraling out of control for us financially with health care.
State Treasurer Dale Falwell released a new report Wednesday criticizing nonprofit hospitals for receiving tax breaks but still trying to collect from people who should have their bills forgiven. He says some hospitals are suing patients or encouraging them to open credit cards.
This is really happening right in front of our eyes.
The report says between 12 and almost 30% of hospital bad debt belongs to patients eligible for charity care. Researchers criticized hospitals for reporting inconsistent or incomplete data, making it difficult to get a clear picture.
Clearly, there are severe problems in terms of data transparency, that there are so many hospitals that are failing to report all the required information.
The North Carolina Healthcare Association, which represents the state's hospitals, said Falwell is attacking and demonizing hospitals as they grapple with the latest COVID-19 surge. They said the report fails to account for the community benefit they provide. Falwell referred to his own battle with COVID-19 when the pandemic first started.
This is not about the people who actually do the work of healthcare. The people who squeezed my hand, who got me through ICU.
The treasurer says Wake Med here in Raleigh is the only large system in the state that provided more in charity care than what they got in tax breaks in 2020. State lawmakers say they want to talk to hospital leaders about this, potentially propose new legislation, but it's not clear yet exactly what that would entail. Live in Raleigh, Michael Hyland, CBS 17 News.